Welcome to the Basic Infection Control Skills License, or BICSL, training module. Part 1, Hand Hygiene. Hands are the main pathways of germ transmission during healthcare. When healthcare workers fail to clean their hands between patient contact, germs in their hands can be passed from person to person and spread infection. Hand hygiene is, therefore, the most important measure to avoid the transmission of harmful germs and prevent healthcare-associated infections. Hand hygiene is considered the main part of the standard precautions that are the minimum infection prevention practices that apply to all patient care. How and when to practice hand hygiene. 1. Alcohol-based hand rub. Duration of the entire procedure, 20 to 30 seconds. Wash hands instead when visibly soiled. How to hand rub. 1. Apply a palmful of the product in a cupped hand, covering all surfaces. 2. Rub hands palm to palm. 3. Right palm over left dorsum with interlaced fingers and vice versa. 4. Palm to palm with fingers interlaced. 5. Backs of fingers to opposing palms with fingers interlocked. 6. Rotational rubbing of left thumb clasped in right palm and vice versa. 7. Rotational rubbing backwards and forwards with clasped fingers on right hand and left palm and vice versa. 8. Once dry, your hands are safe. 2. Hand washing with soap and water. Duration of the entire procedure, 40 to 60 seconds. How to hand wash. Wet hands with water. 1. Apply enough soap to cover all hand surfaces. 2. Rub hands palm to palm. 3. Right palm over left dorsum with interlaced fingers and vice versa. 4. Palm to palm with fingers interlaced. 5. Backs of fingers to opposing palms with fingers interlocked. 6. Rotational rubbing of left thumb clasped in right palm and vice versa. 7. Rotational rubbing backwards and forwards with clasped fingers of right hand in left palm and vice versa. 8. Rinse hands with water. 9. Dry hands thoroughly with a single-use towel. 10. Use towel to turn off faucet. 11. Your hands are now safe. When hands should be cleaned. 5 moments for hand hygiene. Moment 1. Before touching a patient. Why? To protect the patient against colonization and, in some cases, against exogenous infection by harmful germs carried on your hands. When? Clean your hands before touching a patient when approaching him or her. Moment 2. Before clean or aseptic procedure. Why? To protect the patient against infection with harmful germs, including his or her own germs entering his or her body. When? Clean your hands immediately before accessing a critical site with infectious risk for the patient. For example, a mucous membrane, non-intact skin, an invasive medical device. Moment 3. After body fluid exposure risk. Why? To protect you from the colonization or infection with patients' harmful germs and to protect the healthcare environment from germ spread. When? Clean your hands as soon as the task involving an exposure risk to bodily fluids has ended and after glove removal. Moment 4. After touching a patient. Why? To protect you from colonization with patient germs and to protect the healthcare environment from germ spread. When? Clean your hands when leaving the patient's side, after having touched the patient. 5. After touching patient surroundings. Why? To protect you from colonization with patient germs that may be present on surfaces or objects in patient surroundings, and to protect the healthcare environment against germ spread. When? Clean your hands after touching any object or furniture when leaving the patient's surroundings, without having touched the patient. Part 2. Personal Protective Equipment, or PPE. Personal protective equipment is special equipment you wear to create a barrier between you and germs. This barrier reduces the chance of touching, being exposed to, and spreading germs. Personal protective equipment, or PPE, helps prevent the spread of germs in the hospital. This can protect patients and healthcare workers from infections. Gloves, gowns, surgical masks, eye goggles, face shield, and respirator masks are all examples of PPE that may be worn in the provision of healthcare. Types of personal protective equipment, or PPE. Gloves should be worn when there may be exposure to blood, bodily fluids, secretions, or excretions, and when handling contaminated equipment. Aprons and gowns should be worn to protect uniforms and clothing from moisture or soiling during direct patient care. Face shield or goggles should be worn when there is a risk of body fluids splashing onto mucous membranes, like eyes and nose. Eyes can be protected by wearing either goggles or a face shield. Surgical masks should be worn to protect the healthcare worker from splashes and droplets to the area of the healthcare worker's nose, mouth, and respiratory tract. They do not provide protection against airborne particles. Donning and doffing of personal protective equipment, or PPE. First, sequence for putting on personal protective equipment, or PPE. 1. Gown. Fully cover torso from neck to knees, arms to end of wrists, and wrap around the back. Fasten in back of neck and waist. 2. Mask or respirator. Secure ties or elastic bands at middle of head and neck. Fit flexible band to nose bridge. Fit snug to face and below chin. Fit check respirator. 3. Goggles or face shield. Place over the face and eyes and adjust to fit. 4. Gloves. Extend to cover wrist of isolation gown. One. Gloves. Outside of gloves are contaminated. Using a gloved hand, grasp the palm area of the other gloved hand and peel off first glove. Hold removed glove in gloved hand. Slide fingers of ungloved hand under the remaining glove at wrist and peel off second glove over first glove. Discard the gloves in a waste container. 2. Goggles or face shield. Outside of goggles or face shield are contaminated. If your hands get contaminated during goggle or face shield removal, immediately wash your hands or use an alcohol-based hand sanitizer. Remove goggles or face shield from the back by lifting headband or earpieces. If the item is reusable, place in designated receptacle for reprocessing. Otherwise, discard in a waste container. 3. Gown. Gown front and sleeves are contaminated. If your hands get contaminated during gown removal, immediately wash your hands or use an alcohol-based hand sanitizer. Unfasten gown ties, taking care that sleeves don't contact your body when reaching for ties. Pull gown away from neck and shoulders, touching inside of gown only. Turn gown inside out. Fold or roll into a bundle and discard in a waste container. 4. Mask or respirator. Front of mask or respirator is contaminated. Do not touch. If your hands get contaminated during mask or respirator removal, immediately wash your hands or use an alcohol-based hand sanitizer. Grasp bottom ties or elastics of the mask or respirator, then the ones at the top, and remove without touching the front. Discard in a waste container. 5. Wash hands or use an alcohol-based hand sanitizer immediately after removing all PPE. Transmission-based precautions. Droplet precautions. This patient suffers from flu. People with flu can spread it to others within 1 to 2 meters away. Droplet transmission of flu viruses spread mainly by droplets made when people with flu cough, sneeze, or talk. These droplets can land in the mouths or noses of people who are nearby or possibly be inhaled into the lungs. Examples of diseases transmitted by large droplets include influenza, meningococcal meningitis, and pertussis. Precautions must be implemented to prevent droplet transmission. Implementation of droplet precautions. The patient should be placed in a single room if available, and the door can remain open. If single rooms are not available, patients who are infected or colonized with the same microorganism may share a room. Staff should wear a surgical mask when within 1 meter of the patient. In addition, the staff should perform hand hygiene prior to entering and immediately after leaving the patient's room. Airborne precautions. This patient suffers from open pulmonary tuberculosis. TB bacteria are spread through the air from one person to another. Airborne transmission occurs when the bacteria or viruses travel on dust particles or small respiratory droplets that may become aerosolized when some people sneeze, cough, laugh, or exhale. They hang in the air much like invisible smoke. They can travel on air currents over considerable distances. Examples of diseases transmitted by airborne routes include tuberculosis, measles, and chickenpox. Precautions must be implemented to prevent airborne transmission. Implementation of airborne transmission. Patients with a suspected or confirmed airborne infectious disease should be isolated in a negative pressure room. Pressure differentials should be monitored daily when the room is in use. Healthcare workers should wear appropriately fit-tested N95 respirator upon entering the room. The respirator should be removed outside the patient room after use, followed by hand hygiene. Contact precautions. This patient has a wound infected with a multi-drug resistant organism. This type of infection can spread by touching the patient or infected surfaces in the room. Examples of diseases that can be transmitted through direct or indirect contact include gastrointestinal infections, including diarrhea of unknown origin, wound and skin infections, such as impetigo, and colonization with multi-drug resistant bacteria, such as methicillin-resistant Staphylococcus aureus, or MRSA. Precautions must be implemented to prevent contact transmission. Implementation of contact precautions. The patient should be placed in a single room if available, and the door can remain open. If single rooms are not available, patients who are infected or colonized with the same microorganism may share a room. Staff should wear a long-sleeved gown and gloves for all interactions that may involve contact with a patient or the patient's environment. In addition, the staff should perform hand hygiene prior to entering and immediately after leaving the patient's room.
Before donning mask, perform hand hygiene and don gloves. Prior to donning your N95, assure your hair is tied up. Make sure no makeup is worn, as this compromises the mask and it cannot be decontaminated or reused. Ask a coworker to assist or use a mirror to check the placement of your N95 mask. Cup the mask and bring it up to your face. The mask should sit center on the bridge of your nose. Most masks seal best when they are high on the bridge of the nose. Bring the top strap over your head and place it just above your ears. Then bring the bottom strap over your head and place it just below your ears. Without touching your face, use 2 fingers from each hand and gently mold the metal bar to your nose. Do not pinch or poke, as this causes peaks and makes an improper seal. Now perform your seal check by placing your hands above and below the mask without touching your face or eyes, and blow out forcefully. Assure you do not feel air escaping around the borders of the mask with those breaths. If you do not feel air, you are now good to go. If you did feel air escaping, you may have to move the mask up or down and perform another seal check. If this does not work, you can crisscross your straps to make them tighter. Before adjusting the straps, perform hand hygiene. Slightly lower the upper strap, then raise the lower strap to cross over the upper strap. The straps should be crossed just above your ears. Perform another seal check to assure proper fit. If you still cannot get a proper seal, please seek out your supervisor. If you do have a proper seal, perform hand hygiene and you are now free to do patient care.
Today's video, we have Dr. Gladys Fernandez, the Education Director for the Simulation Center at Bay State Medical Center, here to help us safely don and doff a PAPR. Before Dr. Fernandez is ready to don the PAPR, she needs to ensure that she has all of the supplies that she needs. So she needs hand hygiene product. She needs something to clean it with. So that can be either a Super Sani cloth or Virex 256. Please note that the Super Sani cloths have a 2-minute contact time, whereas the Virex 256 has a 10-minute contact time. And what that means is that is the amount of time that the product needs to remain wet on your PAPR hood in order to be effective. She also needs a PAPR hood, a PAPR blower/battery mechanism, which is the heavy pack that she's holding there, and the tubing that connects the battery pack to the PAPR hood. She also needs a pair of gloves in her size and a disposable gown. So to start, she's going to clean her hands. When she's done cleaning her hands, she'll don a pair of gloves in order to sanitize the mechanism prior to using it. Dr. Fernandez is going to demonstrate using Super Sandy cloths. If you're going to use Virex 2256, you'll also need a blue microfiber cloth. These are available on most of the units, and when you are finished with a blue microfiber cloth, please dispose of it within the patient laundry. Start by taking a Super Sandy cloth and cleaning the inside of the PAPR hood. Then clean the outside of the PAPR hood. Next, she'll clean the battery pack and hosing mechanism. Now that the PAPR is clean and ready for use, and 2-minute contact time has elapsed, before donning it, you have the option to wipe it out on the inside with a moist paper towel if you have experienced irritation of your eyes or your nose due to the residual chemical from Super Sandy cloths. Dr. Fernandez is now ready to don the PAPR. So the first step is to don the hood. It's easiest if you grasp it and place it under your chin first and then roll it onto the top of your head. Ensure there is a good seal around your chin and your face. Next, don the belt. Make sure that the blower and battery pack unit is seated at the small of your back. Attach the hose to the hood. Should hear it click. Turn it on. You should hear air blowing around your ears. Next, don a gown. Be sure not to break the neck hole of the gown, placing it over the PAPR. Next, Dr. Fernandez will remove her gloves and perform hand hygiene prior to placing a new pair of gloves on. Make sure that your gown is fitted so that if there are thumb holes, your thumbs are through thumb holes. The air entry to the blower is right below the 3M symbol. Ensure that your tie is below this, not obscuring the air entry point. Dr. Fernandez is ready to take care of patients. Dr. Fernandez is finished taking care of patients. She's going to doff her PPE safely. First, by pulling the gown to release the ties and rolling the sleeves off of her arms and removing the gloves in one block. She then performs hand hygiene. And exits the room and prepares to doff her PAPR. She starts by cleaning her hands if she touched the door or any other patient care equipment prior to leaving the room. Next, she'll don a pair of gloves and get ready to clean the PAPR for the next user. Again, Dr. Fernandez is going to demonstrate using super sani cloths. To sanitize the PAPR for the next user, first start by cleaning the outside of the PAPR. Doff the PAPR hood and sanitize the hose. Note that the belt and the blower, as well as the hose, has been inside your gown and is protected. This is a sanitizing step. Lastly, clean the inside of the PAPR. And perform hand hygiene. When you've completed the cleaning of your PAPR and removed it to storage, please clean the table that you used to clean your device. Dr. Fernandez is going to demonstrate cleaning the table with Virex 2256. Using the squirt top bottle prevents aerosolization of the product and is the preferred method. Saturate the cloth and wipe down the table. Ensure that the table remains damp with the Virex 2256 for 10 minutes. Discard the microfiber cloth into the dirty laundry.
Needle stick injuries are a common occupational hazard among all healthcare workers, including you. It's estimated that 600,000 to 800,000 needle stick injuries occur per year in the United States alone. In the Oral Health Center here in IMU, we have had a total of 20 reported injuries from the year 2012 to 2016. There may have been many more unreported incidents. But what is a needle stick injury and how can it be prevented? Needle stick injury is defined as an injury caused by contaminated sutures, hollow bore needles, or any sharp instrument that has broken the skin, causing bleeding. Here are some of the ways it can happen. Scaling, giving local anesthesia, suturing, endodontic treatments, passing instruments, wiring. It's not just dentists or dental students who are affected. All healthcare workers are at risk, even those not in direct contact with patients. For example, a used needle that is not disposed of correctly may injure the workers that handle the waste. Why should we be worried? An injury from a contaminated needle exposes healthcare workers to blood-borne pathogens that can cause serious infections. The most commonly transmitted pathogens are hepatitis B virus, HBV, hepatitis C virus, HCV, human immunodeficiency virus, HIV. Of these three pathogens, only HBV can be vaccinated against. HBV has the highest risk of transmission, ranging from 6 to 30%, while HCV and HIV have an estimated risk of transmission of 1.8% and 0.3%, respectively. So, how do we prevent needle stick injuries? Many can be prevented with 1. Safety measures. In the Oral Health Center, this includes using the syringe holder and recapping your scaler tip. 2. Education, training, and awareness. 3. Work practice controls. Disposal of sharps in sharps bin. Passing exposed sharps using a tray. Proper technique for procedures. All healthcare workers should also make sure that they are vaccinated against hepatitis B to minimize the risk of infection in the case of an injury. What can you do if it happens? 1. Wash the injury with soap and water immediately and dress the wound. 2. Take detailed information about the injury, including when and how it happened and whether the instrument was visibly contaminated with blood. 3. Report the incident to a superior and complete an incident report form. 4. Request for an immediate blood test for both you and the patient involved. 5. Follow up with a medical practitioner for further investigations and counseling. If there is known high risk for infection, your healthcare provider or an emergency room doctor can provide post-exposure prophylaxis. Post-exposure prophylaxis for HIV infection must be started within 72 hours after exposure. But the sooner you start, the better. Every hour counts. The need for post-exposure prophylaxis for HBV is determined by your immune status to HBV. Check your antibody levels with a healthcare provider to see if you need it. Remember, it doesn't take much to prevent an injury. Stay sharp. Avoid sharps.
NHS Education for Scotland. Healthcare associated infections. Blood and body fluid spillages. For healthcare staff working in acute, community, care home and residential settings, dealing with blood and body fluid spillages can be a regular and challenging occurrence. Body fluids, including blood, faeces, vomit and sputum, are considered to be potential sources for blood-borne viruses, for example hepatitis B or other microorganisms. It is therefore vital that all spillages of blood and body fluids are cleaned up as soon as possible, and contaminated surfaces are disinfected immediately. The NHS Scotland National Infection Prevention and Control Manual explains how to successfully manage a blood or body fluid spillage. It contains a handy algorithm to help assess and deal with a range of spillages. There are 5 steps necessary to successfully manage a spillage. Step 1. Cordon the spillage off. Step 2. Assess the type of spillage. The algorithm will help you here. Step 3. Collect the correct equipment. Step 4. Protect yourself. Step 5. Disinfect and clean. Following these steps ensures no harm comes to those we care for, other staff, visitors and ourselves. Using the algorithm in a clinical setting. Nuria is a nurse working in a local hospital. She checks on Brian, a patient, who is sitting in his chair beside his bed. Brian has a needle inserted into his arm to administer his medication. Nuria notices that this has become dislodged and there is a small spillage of blood on the floor. Nuria remembers the 5 steps. Step 1. Cordon the spillage off. Nuria carefully moves Brian in the chair and places wet floor notices around the spillage. Step 2. Assess the type of spillage. Nuria goes over to the sluice area, consults the algorithm which is on the wall, and assesses the spillage by asking the following questions. Is the spillage on soft furnishings or carpet? No, it is on a hard surface. Is the spillage blood, blood-stained fluid, or other bodily fluid? Yes. Nuria can now follow the appropriate steps to successfully manage the spillage. Step 3. Collect the correct equipment. Nuria gathers chlorine-releasing granules, non-sterile disposable gloves and apron, paper towels, general-purpose neutral detergent, and a healthcare waste bag. Step 4. Protect yourself. Nuria then puts on her gloves and apron. Nuria has assessed that she does not need eye or facial protection, as there is no risk of splashing. Step 5. Disinfect and clean. Following the manufacturer's instructions, Nuria applies the chlorine-releasing granules directly to the blood spillage. She wipes up the granules using paper towels and a scoop. She discards all waste into the healthcare waste bag. She washes the area with a solution of general-purpose neutral detergent and warm water with paper towels. She dries the area using paper towels and discards these in the healthcare waste bag. She removes her gloves and apron and disposes of them in the healthcare waste bag. Finally, she carries out hand hygiene. Using the algorithm in a care home setting. Hardeep is a care worker in a care home. He walks past Betty, an elderly patient who has a urinary catheter in. Hardeep notices a large spillage of urine on the floor. He investigates and notices the tap on the catheter bag has not been closed correctly, causing urine to leak from the catheter bag onto the floor. Hardeep recalls the 5 steps. He places physical barriers around the spillage to prevent slippages and harm to other people. He consults the algorithm and assesses the spillage. The spillage is urine on a hard surface. Hardeep knows not to use chlorine-releasing agent directly on the urine spillage, as it will react with the urine and release chlorine gas. He can now follow the appropriate steps to successfully manage the spillage. For further practical guidance on dealing with blood and bodily fluid spillages, including the algorithm, download the NHS Scotland National Infection Prevention and Control Manual here. Download or order hard copies of the following booklets for more information on how to manage blood and body fluid spillages.